Trunk, please. Take it by the handles. Best you can.
Here we go.
Around here, neighbors helping neighbors is a way of life. And Security Health Plan, it's also the way we work.
Hi, this is Dave Miller.
Dave? Hey, neighbor, it's Ivy.
Oh, what's up, Ivy? How you doing?
After all, we live here too, and going the extra mile to help each other out is what good neighbors do. Learn more about our health plan options for you, your family, or your business at securityhealth.org.
Can't leave him out here all night.
Well, look for him first thing in the morning, okay?
Are you sure?
I promise, sweetheart.
Stanley! Here, boy.
Around here, neighbors helping neighbors is a way of life.
Lucy, Stanley's home.
Stanley!
Friend.
James, how is Stanley?
At Security Health Plan, it's also the way we work. We'll help you find the right Medicare plan, even if it's not ours. Attend a seminar, schedule a personal visit, or stop by an answer center today.
Are you ready for Medicare? Talk about a tricky subject. Hi, I'm Brian Kelly for Security Health Plan. Over the next half hour, I'll help you gain a better understanding of Medicare in general. I'll talk about Security Health Plan's options for Medicare coverage, including Medicare Advantage, Medicare Supplement, and Medicare Medical Savings Account plans. Before we get to that, I bet some of you are wondering, what is Security Health Plan? Robin from our sales team met recently with a potential member about Security Health Plan and our Medicare plans.
I've heard of Security Health Plan, but I don't know a whole lot about it. What can you tell me about it?
Well, Security Health Plan is a nonprofit health insurance company based right here in Wisconsin. We help our members reach their best health by making sure that they have access to high-quality, affordable health insurance.
Security Health Plan has been around for more than 48 years at our headquarters in Marshfield. We're based here. Most of us are from here. We share your Midwestern values and work ethic. We understand what matters most to you. Now, on to Medicare. Now, this may be the first time you can enroll in a Medicare plan, or you might be thinking about switching your plan. But what is the right choice for your lifestyle and budget? Well, that's what I'm here to help you understand. I think you'll find that Security Health Plan has a Medicare plan that's right for you. Let's start by covering some Medicare basics.
I hear a lot about Medicare parts, Part A, Part B. What does all of that mean?
Well, I get this question a lot. Parts A and Part B make up what's called Original Medicare. Part A pays for some of your hospital charges. Part B pays for some doctor office visits and outpatient care.
When you only have Original Medicare Parts A and B, you are responsible for the remainder of the costs for all these services, including large deductibles and coinsurance. And you should note that Medicare has no limits for how much you'll have to pay out of pocket in a year. This is where Medicare supplement plans come into play. You still have Original Medicare Parts A and B, but the supplement plan helps pay for the deductibles, co-payments, and coinsurance. Security Health Plan offers a supplement plan that can be a valuable option for protecting you against additional costs. There are also two more parts to Medicare, Part C and D. Medicare Part C is commonly known as Medicare Advantage. Medicare Advantage plans replace Original Medicare by covering Part A and Part B services. Your coverage and claims are handled by contracted third parties, like Security Health Plan. Medicare Advantage plans not only cover Parts A and B, but they go well beyond Original Medicare by offering additional services. For example, many of Security's Medicare Advantage plans include worldwide coverage for emergency and urgent care, routine dental, hearing, and eye exams, eyeglasses, hearing aids, and much, much more. Medicare Advantage plans simplify your life by combining all Medicare coverage under one plan. Finally, Medicare Part D is Medicare's prescription drug coverage. There are multiple ways to receive Part D coverage. For example, most of our Medicare Advantage plans include Part D coverage. Alternatively, you could purchase a standalone Part D drug plan to match with a supplement or Medicare Medical Savings Account plan. We'll go over all of this a little later.
Trunk, please. Take it by the handles. Best you can.
Here we go.
Around here, neighbors helping neighbors is a way of life. And Security Health Plan, it's also the way we work.
Hi, this is Dave Miller.
Dave? Hey, neighbor, it's Ivy.
Oh, what's up, Ivy? How you doing?
After all, we live here too, and going the extra mile to help each other out is what good neighbors do. Learn more about our health plan options for you, your family, or your business at securityhealth.org.
Medicare Parts A, B, and D help cover your costs for hospital stays, doctor visits, and prescription drugs. Straightforward, understandable. But Part C, Medicare Advantage, is quite a bit different. I'm thinking you might want to know more about Medicare Advantage.
Tell me more about Medicare Advantage, like when can I enroll?
That's a short question with a longer answer. There are actually 4 options when you can enroll, depending on your situation.
The first option is called your initial enrollment period. This is when you first become eligible for Medicare. You have 3 months prior to and 3 months after your eligibility month to join a Medicare plan. For most people, your eligibility month is the month you turn 65. For example, if you turn 65 on April 14th, you can enroll in any of the 3 months prior to April, January, February, or March, during your birthday month of April, or during any of the 3 months following April, May, June, or July. In short, you have a 7-month window to enroll when you are enrolling in Medicare for the first time. Option 2. Each year after your initial enrollment, you'll have an annual enrollment period, or AEP. During this time, you can make changes to your Medicare Advantage coverage, add or drop coverage, or switch plans. This annual enrollment period runs from October 15th through December 7th. Option 3 is the Medicare Advantage Open Enrollment Period, or OEP. Once you have a Medicare Advantage plan, you can move to another Medicare Advantage plan or Original Medicare from January 1st through March 31st each year. Finally, Option 4, Special Enrollment Period, or SEP. As the name implies, SEPs arise under special circumstances, such as moving out of your planned service area, moving into or out of a long-term care facility, becoming fully eligible for dual benefits in both Medicare and Medicaid, leaving a group health plan offered through an employer or union, getting extra help paying for Medicare prescription drug coverage, or losing your current creditable drug coverage. Now that we know when you can enroll in a Medicare Advantage plan, let's talk about the Medicare plans available in your area. Before we look at plan specifics, I should mention that Security Health Plan's Medicare plans are available only to residents of Wisconsin.
What plans are available for me?
Well, the plans that you can buy depend on where you live. But the good news is that Security Health Plan offers Medicare Advantage plans to all 72 counties in Wisconsin. We'll help you find the best plan, even if it's not ours. But with our plan choices and the extra benefits we include, I'm confident we have options that will meet your budget and health insurance needs.
Let's start with our HMO point of service plans. These are available in about 2/3 of the state, divided into 3 main areas, as you see here. If you live in one of the 10 counties in the blue area seen here, your options include 3 plans with medical and prescription drug coverage and 2 plans with medical coverage only. These plans are Assurance RX with medical and prescription drug coverage, Essence RX with medical and prescription drug coverage, Essence with medical coverage only, Spirit RX with medical and prescription drug coverage, and Spirit with medical coverage only. In addition to these Medicare Advantage plans, we also have our Secure Saver Medicare Medical Savings Account, or MSA plan, which is available statewide. We'll look into that plan in more detail shortly. I'll bet a lot of you are thinking, that's a lot of choices. How do I pick the right one for me?
When I look at health insurance plans, I just get overwhelmed. How do I choose?
Well, when you're trying to choose a health plan, there are a number of things that you'll want to consider. One of the most important factors, of course, is whether you can see the doctor of your choice.
Our HMO point of service plans have an extensive network that includes thousands of doctors and healthcare professionals, convenient hospitals, and clinics in your region. Some of the largest, most well-known providers are shown on this map. You get the best value for your medical care when you use providers who are in your network. However, one of the biggest advantages of Security's HMO point of service plans is that you have the option to use healthcare providers who are not in your network. To do so, you may have to pay a higher cost. The cost difference varies by plan. The cost of monthly premiums and what you pay out of pocket when you use healthcare services is also a big factor. Assurance RX, for example, is a $0 premium plan that covers all your health care plus Part D prescription drugs. 2 Essence plans have premiums of $16 per month without drug coverage and $80 per month including Part D drug coverage. You pay less when you use health care with Essence plans than with Assurance. We also have 2 Spirit plans with higher monthly premiums, but you pay much less when you need to use health care. Spirit without drug coverage is $157 per month, and with drug coverage is $222 per month. With all plans, you must continue to pay your Medicare Part B premium. I would guess that some of you may be wondering about Part D prescription drug coverage.
I use quite a few prescriptions. How are they covered?
Your use of prescriptions is good to know when thinking about your coverage. In addition to the basics covered by Medicare Advantage HMO point of service, you should consider a plan with Part D prescription drug coverage.
Enrollment in Part D prescription drug coverage is voluntary, of course, and you can sign up whenever you like. However, late enrollment penalties may apply if you enroll in Medicare Advantage now and then sign up for your Part D plan later. So it's to your advantage to make it a part of your plan from the outset. If you have Medicare Advantage HMO point of service coverage, you must receive your Medicare Part D drug benefits through that plan. You cannot have a Medicare Advantage HMO point of service plan and a separate standalone Part D plan. If you enroll in a separate Part D plan while you are already a member of one of our plans, Medicare will disenroll you from your Security Health Plan coverage. You can, however, use prescription drug discount programs like Wisconsin Senior Care, TRICARE, or Veterans Affairs. One significant benefit of Security Health Plan's Medicare Advantage HMO point of service plans with Part D coverage is you pay $0 for vaccines. That includes all Part D vaccines, such as the shingles vaccines, which can be very expensive without the plan. It also covers routine tetanus shots. Finally, you may be able to get help paying for your prescription drug premiums and costs. To see if you qualify to get extra help from Medicare, call 1-800-MEDICARE, the Social Security Administration, or the Wisconsin Department of Health Services. The next important topic you may be wondering about: how will Security's Medicare Advantage plans cover my health care?
When I think of my medical needs, how will Security's Medicare Advantage plan make sure I'm taken care of?
Our main focus is to make sure you receive the care you need to be as healthy as possible. Our Medicare Advantage plans cover everything that's covered by Original Medicare, but we don't stop there. We also offer benefits beyond what you get with Original Medicare alone in support of your health and your budget.
The benefits you get with Security's Medicare Advantage plans include additional coverage for hearing, vision, and dental care, preventive health services at no cost to you, such as mammograms and colonoscopies, a $30 quarterly credit to buy over-the-counter health and wellness products from our mail-order catalog, convenient mail-order prescriptions, 2 weeks of meals delivered to the home of members with congestive heart failure after an inpatient hospital or skilled nursing facility stay, worldwide emergency and urgent care coverage, innovative ways to provide care for you when and where you need it, such as our 24-hour nurse line and Care My Way, which offers flexible, convenient, and quick care for common health conditions right over the phone. Telehealth services available with certain providers who offer advice and care by phone, online chat, interactive two-way video, or other means, and much more. Let's dig a little deeper into our dental, hearing, and vision benefits. For hearing benefits, we offer 1 hearing exam per year. You pay only a co-payment for the exam with a network provider of $25 or $50, depending on your plan. We also offer up to 2 hearing aids per year. You pay only a $500 co-payment for each hearing aid, up to 2 aids per calendar year. For vision benefits, you can get 1 free routine preventive eye exam per year. If you need a diagnostic eye exam for injury or illness, you pay only the co-payment or co-insurance for your plan. We will also pay a stipend of $175 toward the purchase of eyeglasses for your routine vision correction needs. For dental care, we've partnered with Delta Dental to offer 1 free preventive exam per calendar year when you use a network dentist. You pay nothing for the exam, which includes a preventive cleaning or periodontal maintenance cleaning and 1 set of x-rays, full mouth series, bite wing x-rays, or panoramic. As a member of Security Health Plan, you also have the option of purchasing a supplemental dental plan for an additional premium of $34 per month. We've partnered with Delta Dental as well for this benefit. When purchased, this coverage is added to the preventive dental benefits that are standard with your Medicare Advantage plan. This coverage is subject to a $1,000 maximum annual benefit. If you choose this coverage, you get one additional exam and cleaning per calendar year at no cost in-network and 20% coinsurance out-of-network. Emergency treatment of pain, as well as fluoride treatments at 20% coinsurance in-network and 50% coinsurance out-of-network. And restorative care, fillings, root canals, crowns, gum disease, implants, dentures, oral surgery, and more. You pay a $100 deductible for these services, then 50% coinsurance in or out-of-network. Please note that if you disenroll from your Medicare Advantage plan, your supplemental dental benefit will also end. Before we move on, let's recap what we've learned about Security's Medicare Advantage HMO point of service plans. First, you can choose the plan that best fits your health and budget. And within your network, you can select from thousands of high-quality doctors, hospitals, and other healthcare professionals to make sure you receive first-rate care. Our network includes all Marshfield Clinic Health System facilities and providers, plus those affiliated with Ascension North Region, Aspirus, Bellin Health System, Theta Care, Essentia Health, St. Luke's Duluth, Mayo Clinic Health System, most Oakleaf Medical Network providers, Sacred Heart Hospital Eau Claire, St. Joseph's Hospital, Chippewa Falls, Western Wisconsin Prevea Health locations, UW Health Systems, Unity Point Meritor, Group Health Cooperative, Monroe Clinic, and many more. You also have out-of-network coverage that lets you see any Medicare-certified provider in the United States that is not opted out of Medicare. You receive invaluable health services at no extra cost. These include Medicare-covered preventive services such as mammograms and colonoscopies, vaccines, and diabetes testing supplies. You also receive important services beyond what Medicare covers. Vision, free annual eye exam and a $175 allowance for eyeglasses, depending on your plan. Hearing, one routine hearing exam is covered. Hearing aids, you pay only a $500 copayment per aid for up to 2 aids per year. Dental, free dental exam including preventive or periodontal maintenance cleaning and 1 set of x-rays, full mouth series, bite wing x-rays, or panoramic. You also have the option to add a supplemental dental plan that you can buy for a $34 monthly premium. This plan adds an additional exam and cleaning, emergency pain treatment, fluoride treatments, and restorative care, including fillings, crowns, root canals, implants, dentures, and more. And whenever you feel the need, you can talk free of charge with health professionals on our staff who will work with you to help you stay as healthy as possible and manage your chronic conditions. These include health coaches, registered nurse care managers, and social workers. Also, when you choose one of our Part D plans, you can get a free medication review from a pharmacist who will help you understand your prescriptions, make sure you're getting the best results, and keep your out-of-pocket costs down. You get the care you need without unexpected hassles. You don't have to be in the hospital for 3 days before you can receive care to recover from an illness or injury at a skilled nursing facility. In most situations, you pay nothing for self-administered medications you receive while in the hospital for an outpatient observation stay or emergency room setting. You have one less worry if you travel, because we will cover your emergency and urgent care anywhere in the world. Your costs are not based on your age or medical concerns. In other words, your premium won't increase because you get older or if you experience a medical condition. All members within each Medicare Advantage plan option pay the same monthly premium and have the same maximum annual out-of-pocket limit. And finally, your calls will go to our friendly, award-winning customer service professionals and benefit specialists right here in Wisconsin, who will answer your questions and get you the help you need.
Can't leave him out here all night.
Well, look for him first thing in the morning, okay?
Are you sure?
I promise, sweetheart.
Stanley! Here, boy.
Around here, neighbors helping neighbors is a way of life.
Lucy, Stanley's home.
Stanley!
Friend.
James, how is Stanley?
At Security Health Plan, it's also the way we work. We'll help you find the right Medicare plan, even if it's not ours. Attend a seminar, schedule a personal visit, or stop by an answer center today.
Before Medicare, I was enrolled in a health savings account. Is there something similar for Medicare?
That's a great question, and the answer is yes. Security Health Plan offers our Secure Saver Medicare Medical Savings Account. We call it MSA for short.
Here's how our Secure Saver MSA plan works. Begin by enrolling in an MSA plan through Security. We'll work with a company called Optum Bank, member FDIC, to set up your MSA. Then you'll receive a welcome kit and a debit card for use on qualified medical expenses. Each year, Medicare, through Security Health Plan, deposits a fixed amount into your Optum Bank MSA. When you visit your healthcare provider, you can pay from your own funds or use funds from your MSA to pay for those services. Once you've met your deductible, Security Health Plan will cover your costs until the end of the year. For example, in 2020, the Secure Saver MSA plan deductible will be $5,600. Medicare provides an initial deposit of $2,184, meaning the difference of $3,416 is your total out-of-pocket expense for the year. Any money from your MSA that goes unspent rolls over to the next year, and you can use your Secure Saver funds for any qualified medical expense. You get all of this for a $0 monthly premium and no monthly maintenance costs. There are a few caveats. 1. You must continue to pay your Medicare Part B premium. 2. While you may use your MSA funds for non-Medicare costs, such as prescriptions, dental care, dentures, eye exams, hearing aids, cosmetic surgery, and more, only Medicare-covered expenses will count toward your deductible. 3. Secure Saver MSA does not cover prescription drugs. If you join a Medicare MSA plan, you can also join any separate Medicare prescription drug plan. You can have a standalone Part D prescription drug plan or a plan such as Wisconsin Senior Care to help you pay for your prescriptions. Finally, if you must disenroll for some reason, like moving away from Wisconsin, you'll need to pay a prorated portion of the Medicare deposit back to the plan, and that's our Secure Saver MSA. Let's talk about one more plan option that may be familiar to you, a Medicare supplement.
A lot of my friends have a Medicare supplemental plan. Does Security?
Yes, Security Health Plan offers a Medicare supplement. A Medicare supplement can be a good option if you want to stay with original Medicare, but want a little more coverage for out-of-pocket costs not covered by original Medicare, along with the flexibility of using any doctor you choose.
With a supplement plan, you can see any Medicare certified provider in the United States that is not opted out of Medicare. You can also add riders to give yourself even more coverage. Let's dig deeper. These optional riders allow you to choose your premiums and out-of-pocket levels to fit your personal and financial needs. First up is the Part A deductible rider. This rider protects you from Medicare's hospital deductible, which is currently $1,364 each benefit period. What's a benefit period? Here's an example. After you leave the hospital and have not received skilled nursing care for 60 straight days, that marks the beginning of a new benefit period. As you can see, it's possible you could have several of these benefit periods in a single year. Next, the Part B excess charges rider. This rider is valuable if you use a provider that does not accept Medicare assignment. We will pay the difference between what Medicare pays and what your provider charges. The additional home health care rider. This rider guarantees that you'll be covered for home health care for an aggregate of 365 visits per policy year, as required by Wisconsin law. It adds some coverage for home health care that is not covered by Medicare. However, because Medicare pays for the majority of home health care services, this rider may not substantially broaden coverage. Then there's the foreign travel emergency rider. After you pay a $250 deductible, we will pay 80% for emergency medical care received outside of the U.S. Care must occur during the first 60 days of the trip, and there is a lifetime limit of $50,000. Finally, there's the Medicare Part B copayment or coinsurance rider. It is a little different. With all the other riders, you pay an additional premium to avoid charges. This one is sort of the reverse of that. With it, you can reduce your premium by agreeing to pay some charges that your supplement policy would otherwise cover. Things like a $20 copayment for office visits, or a $50 copayment for emergency room visits. Why purchase a Medicare supplement? 1. Unlike with an HMO, there's no provider network. See any Medicare certified provider in the U.S. that has not opted out of Medicare. 2. Competitive premiums. Plus, there is no application fee to apply for coverage. 3. Guaranteed availability. Our Medicare supplement is available to all Medicare-eligible Wisconsin residents. And once you have it, you cannot be canceled or charged more than anyone else your age because you develop costly health problems. 4. Unlimited preventive care. Medicare mandates free access to most preventive health care. Security Health Plan takes that a step further by paying 100% for most annual physicals, preventive tests, and services that are not covered by Medicare. Again, our purpose is to keep you healthy. Those are all the Medicare plan options offered by Security Health Plan. I hope we've shown you today that we put our members first. We do that because we really do care. We're not some national company with a headquarters halfway around the country and call centers halfway around the world. We're local. We're right here in Wisconsin. When members call with questions, you'll speak to a real person in Marshfield. Most of our employees are from here. This is our home. You are our neighbors, our friends, our family. Doing right by you is what we're all about.
You've given me such great information. Thank you so much for helping me find the Medicare plan that's just right for me.
I am so happy I was able to help you. Now that you've enrolled in Security Health Plan, you are welcome to call me or our customer service team anytime you have a question about your coverage.
To sign up for Medicare coverage with Security Health Plan, simply call the number below or visit the website for more information. Security Health Plan's Medicare plans are only available to Wisconsin residents. While some of our Medicare plans are available throughout Wisconsin, our Medicare Advantage HMO point-of-service plans are only available in specific counties. Please check our website at www.securityhealth.org/south or call our sales department at 1-877-909-1045 to find out exactly which plans are available in your county. Thank you.
Trunk, please. Take it by the handles. As best you can.
Around here, neighbors helping neighbors is a way of life. And Security Health Plan, it's also the way we work.
Hi, this is Dave Miller.
Dave? Hey, neighbor, it's Ivy.
Oh, what's up, Ivy? How you doing?
After all, we live here too, and going the extra mile to help each other out is what good neighbors do. Learn more about our health plan options for you, your family, or your business at securityhealth.org.
Can't leave him out here all night.
Well, look for him first thing in the morning, okay?
Are you sure?
I promise, sweetheart.
Stanley. Here, boy.
Around here, neighbors helping neighbors is a way of life.
Lucy, Stanley's home.
Stanley!
Friend.
James. How is Stanley?
At Security Health Plan, it's also the way we work. We'll help you find the right Medicare plan, even if it's not ours. Attend a seminar, schedule a personal visit, or stop by an answer center today.